Patient Navigation Process Standard 3.1 is a 2012 standard with a phase-in date of January 1, 2015. All cancer programs will be required to demonstrate that they have the ability and resources to assist cancer patients, families, and caregivers in moving or navigating through the gaps and barriers to quality cancer care throughout their cancer journey. This standard defines a process, not a person. A community needs assessment will be conducted by Cancer Committee to identify gaps and barriers specific to their program. This needs assessment functions as a guide in developing the appropriate methods and tools necessary for compliance. Patient navigation is important because healthcare systems are complex. As patients fight for their lives, they are scheduled for multiple diagnostic tests, meetings with specialists, and starting treatments. Medical concerns are not the only challenges. Financial issues, worry about insurance coverage or lack thereof, fears and stress about the diagnosis, language barriers, and whether or not they qualify for assistance programs can adversely affect a cancer patient's quality of life. Delays in diagnosis or starting treatment can negatively impact survival. Programs meet the standard by conducting a community needs assessment early and at least once in the 3-year survey cycle. The focus is on the population served, any cancer health disparities, and identifying resources that may be lacking. The Cancer Committee analyzes the information and designs the navigation process in a way that connects patients with appropriate services, communicates between medical professionals and patients, and utilizes community outreach efforts. Compliance is rated by reviewing documentation detailing the community needs assessment, the analysis of that assessment, and resultant services to address barriers. Services are provided either on-site or by referral. The navigation process and barriers, along with modifications and improvements, must be evaluated, documented, and reported to Cancer Committee annually. Documentation consists of completing the SAR, providing a copy of the community needs assessment with its evaluation, as well as a report on the navigation process. During the survey, the navigation process will be discussed with Cancer Committee. There is no commendation for this standard. The completion of the needs assessment does not fulfill the requirement for Standard 4.7. A multidisciplinary approach is crucial in complying with this standard. Quality cancer care is complex. Knowledge and expertise from various healthcare providers who work with cancer patients should be utilized when developing practices that will assist cancer patients, their families, and caregivers through the continuum of cancer care. The Best Practices Repository and the use of evidence-based websites are resources for tools and examples that may assist your program in meeting the standard. Thank you for viewing this video on the COC standards, and remember to view the remaining videos in this series to further increase your knowledge on the standards. For additional resources, be sure to visit the COC website at www.facs.org/cancer to access the COC Educational Portal, Best Practices Repository, and Cancer Forum.